hereditary, but did you know that female hair loss affects about 25% of Irish women? Dr. Patrick Treacy from the Aylesbury Hair Clinic is here to tell us more. Patrick, what actually causes hair loss in women?
Okay, there are many different types of female hair loss, and no, over a short period of time, so we'll focus on the main ones. The biggest single cause, probably, that's affecting most of our patients or your viewers out there, is female patterned hair loss, and that has to do with a circulating hormone in the body, dihydroxytestosterone. This is often the reason that women post-pregnancy, for instance, will start losing their hair as well. During pregnancy, they get a big siege of, or surge rather, of estrogen, so they get plentiful hair. That drops when the baby is born, testosterone rises, and as a consequence, they begin losing their hair.
So it's an imbalance, I suppose, really, in the system.
I suppose if we were to look at this model, where the sort of pink is here, that's normally where people will lose their hair due to genetic hair loss or female hair loss. If you're losing it at the sides or at the back, usually that's of another cause.
That's a different cause altogether.
And the two biggest causes of that, one is a thing we call telogen effluvium, and that is when there's a biological shock to the system. For instance, somebody loses their father and mother, somebody may have had a stroke or a heart attack, somebody lost a girlfriend, or it was a result of accident or trauma. What happens is the hair moves from growth phase to resting phase. Unfortunately, the resting phase lasts up to 3 months, so by the time the hair falls out, they often have forgotten the original stress factor that caused it.
Now, we often hear of the hair loss term alopecia. Is that...
That's a generalised thing.
That's a generalised thing. Well, let's take a look at maybe a well-known celebrity, for example.
Okay.
Who, of course, went public.
She did, Gail Porter.
Gail Porter, who went public, lost her hair at a very young age and has talked about it many times. Now, is this type of hair loss likely to ever, is it to reoccur, or will she continue to lose her hair throughout her life? Okay,
that's a very good question. Gail has an autoimmune condition. She probably has alopecia areata, but she may have alopecia totalis because she's lost all her hair in her skull. I noticed that she has eyebrows, so it may be that sort of she has lost some of her hair and shaved off the rest of it. Alopecia areata as an autoimmune disease is very difficult to treat. We inject cortisone Kenlog into the steroids into the scalp. The hair will grow back again. It grows back for about 3 months, and as soon as the medication wears off, it falls off again. Unfortunately, this type of hair isn't really suitable for most of the treatments, minoxidil, laser hair combs, whatever, or even hair transplant, because...
We'll talk about the treatments in a second, Patrick, but there are loads of questions here. One of them is, the crown of my head is bald, and I am very conscious of this. I am in my 70s. What can I do? Jean.
Okay. Jean is almost presenting more with a male pattern type thing, so I'm not sure if it's actually female hair loss. It may be alopecia areata. Jean, I'd really need to see why has she got an isolated thing in her crown, because certainly that's more like a 70-year-old man would have than a 70-year-old woman. What can she do? She may be very suitable for transplant, but we need to work her up, make sure she's an autoimmune, that she's lost. I'd need to know how long it has been there.
But when you do lose a little bit of hair around the crown area, are you saying that's a different type of hair loss again?
Male and female have different patterns, okay? Male normally loses the crown and in the temple, so they get that sort of M pattern. A woman, when she loses her hair due to genetics, actually it's across the top of the scalp, just like this here. Whereas males actually lose it back here and on the sides. A female will lose it here. So to see a female of 70 with an isolated patch there, almost in a male pattern, we'd really need to see her and work her up medically.
Can I hear, there's one that came in here again on, of course, a lot of questions coming in about people that have lost their hair after having a child. How long after having a baby should your hair stop falling out? I had a little girl 12 months ago and I'm still losing a lot of hair.
That's a very interesting question. Most people will get their hair back again within a 6 to 12 month period. Sometimes, if they're prone to genetic hair loss, a trigger like that can trigger it and trigger off the second situation. But as many as 20% of people will begin to lose hair after sort of having a baby. And unfortunately, what happens is it remains in the growth phase, it goes in again to the resting phase, so it's usually a few months after the baby it starts falling out. These sort of patients don't have to worry. Normally, if they just sit tight, the body itself will start to restore its own hormones, and as a consequence, the hair will start growing. Usually, the full hair back within.
She shouldn't panic for a little while. But just another question.
And then also, you've got to remember that it takes about 10 months to grow 6 inches of hair. So a woman's hair even to grow back, sort of, you know, so normally they'll have it all back.
We've another one here, Patrick. I seem to be losing a lot of hair. I had a stroke last year and I'm on medication. Could there be a connection?
That's a very good question again, and it's almost the thing I talked about a moment ago, the telogen effluvium one. When there's a major biological shock to the system, a stroke, a heart attack, after about 3 months the hair starts falling off. That patient as well has mentioned medication. There are certain medications, of course, that sort of cause hair loss. There are certain medical conditions like hypothyroidism can cause it as well. And there are certain people who will say are lacking nutrients in their body, be it iron, zinc, biotin, and they'll lose as well. But they tend to get this diffuse thing where the hair falls out everywhere, you know?
That's interesting that you mentioned certain vitamins and certain nutrients that help, because a lot of people, you know, may be deficient in nutrients. For example, zinc. I didn't know it was so simple as that. Tell us about that and how much zinc they should take, or iron.
Yes. Zinc and magnesium are both underplayed ones. We all know of iron just because of pregnancy. But certainly we know that if you take zinc, you can boost your immune system. We know on analysis also that a certain percentage of people who have diffuse hair loss that maybe even coming in for transplants, all they really need is to put some zinc back in their diet.
How much would you suggest, though? Because when you buy, for example, zinc in a chemist
one
or whatever...
tablet a day.
How many grams?
I'm not sure if the grams are not myself.
Okay, but zinc is certainly a supplement that you require,
We have some solutions, though, Patrick, which is very, very important. So you might go through some of the stuff you have there.
Sure, okay. Well, minoxidil, I suppose, is one of the few treatments that are passed by the Irish Medicines Board, by the FDA, and that's up and running for a couple of different years. We know it probably in the form of Regain.
Yes,
would Regain be wider than this?
Yes. This is 5%, so this is stronger one. It comes in two different solutions, and the stronger solution does tend to work better. It works effectively in about 30% of people. 1/3, it probably doesn't very little. 1/3, it gets some hair back. Obviously, it's not as good as
getting
kind
of a trial and error thing with that, is it? Just to see if it suits you personally?
I think that's fair to say.
How do you use that?
This here, it comes in many. This top comes off. You can have a spray on.
Do you rub it into the scalp?
Yeah,
you rub it into the
it's a topical application. Yes, this is an interesting one here, and this has been passed by the FDA recently. And this red light runs at a certain wavelength. Not to confuse viewers, but it runs at 633. And this can come in the form of a laser comb, even as a skull cap when you're sitting watching television. And the interesting thing is that we know now that this particular wavelength activates a chemical called cytochrome C within the hair follicle. This starts a genome to stop hair shedding. And so this is one of the things that is going to become more and more popular now that the FDA have approved it.
You've been using that for a while.
We've been using red light probably since 2007.
And it's only in the States recently or something, is it?
Well, I suppose as a low-level laser, it's been around for a while, but certainly we won a big award 2 weeks ago for the use of it in hair, believe it or not, in London.
And you've seen good results with that?
It's an adjunct. Certainly, patients that come into us for a hair transplant, we would have most people to be 100% guarantee, and we normally put in 10% extra hairs to allow for hair falling out and shedding and all the rest. When you add this in, that dramatically knocks it back. So it almost makes the hair that you put in grow better.
Okay. There's just another one here. I'm on medication for an underactive thyroid gland. Is it under control? And I get my bloods done regularly. Is that...
Thyroid is an interesting one, and it's always baffled me as a doctor of almost 25 years now, that the results that we have in terms of making a patient euthyroid, so that's back to normal thyroid, still people feel a bit sluggish, people are still losing their hair or maybe putting on weight. So I've always said this thing that probably people should run a little faster. I'm sure most doctors out there wouldn't want me to say that, but there's no doubt about it that one of the things you have to check when a patient comes in with their hair falling out, particularly postmenopausal women, are thyroids. And an awful lot of thyroids are missed. They're missed for the simple reason that it's got an insidious onset. People don't notice them getting a little sluggisher every day, their hair beginning to fall out, their skin beginning to get coarser, their voice dropping. You know, somebody who is hot diagnostically as a doctor would turn around and say, you're obviously thyroid or hypothyroid, but the patient themselves may not notice because it happens over a period of about 2 years. In those patients, believe it or not, when you get them back on their sort of medication, their hair begins to grow back.
So there's hope. Really, I suppose what Dr. Treacy is here today, that there are solutions. Can we just see one photo on screen there of the different patterns, just for people at home, just to see that? These are the type of patterns that women might see. Of course, we don't have time to discuss them all, but just people watching would just feel that maybe they can relate to these type of patterns, and all these can be
Most of those
treated.
probably would be genetic hair loss per se. That's a typical example of genetic hair loss there. You see at the top left, the way it starts with loss across all the top of the scalp, and then it makes its way
to ending at the end.
The bottom right, where it's quite obvious. Yes.
So it is very common, and people at home, not to panic, I suppose you tell them, and there are lots of solutions there.
Absolutely.
Thanks,
yes.
Patrick. Thank you very much, and thanks for joining us today. If you have, of course, or you want any more information on female hair loss, you can ring the Aylesbury Hair Clinic, and that is 01 269 0933. We've got the number on our screens now.